In Lab 8, we are going to build ourselves a skelly, starting with the pectoral girdle. So just to give you guys some context, the pectoral girdle is going to be specifically the clavicle and then the scapula, this guy. So this is really weird unless you know which view you're looking at it from. So let's start with what we learned in class on Lab 7. The clavicle is going to articulate with the clavicular notches of the manubrium. So that's going to be our anterior perspective. The other end of the clavicle, which we haven't talked about yet, is going to articulate with the structure of the scapula called the acromion process. Now, depending on which view you're seeing the scapula from, it's going to look very different. So if we flip around here, I'm going to show you an anterior view of the scapula. Let's try to match this up with Skelly. So we have to move over here to the right side. So this is a lateral view of our right scapula. Our humerus is in the way here, but you can kind of see that same orientation on Skelly. So what we have here, projecting anteriorly, this is our acromion process connecting to the acromial end of the clavicle. We're going to have a couple more processes that we talk about, like this guy here. So now we're in a lateral view of the scapula. Let's see it posteriorly. So now it starts to look a little more familiar. Posteriorly, we're going to have some very prominent structures as well as some fossa. So I tell you that because I can ask you any view. So let's come around here to our disarticulated scapula and talk about some of these landmarks. It's important to know whether you're looking at an anterior perspective or a posterior perspective. So let's start actually posteriorly because this is going to help orient us. So right now we're looking at a posterior view, in this case of our left scapula. So let's talk about this cavity here. This is our glenoid cavity. This is where the scapula is going to articulate with the humerus. It's a really smooth articular surface, so that makes sense. Posteriorly, we have this really prominent line here. This is going to be the scapular spine. This is a great way to orient yourself to which muscles you're looking at as well as where your attachments are. So we're going to define regions of the scapula based on whether they're above or below the spine. So it's a really important one just to orient yourself. So in addition to the spine, we have a couple fossa. So if you remember fossa, they're going to be a type of depression. We're going to have a fossa above the spine. We call that the supraspinous fossa, this guy. We're going to have a fossa below the spine. So that is going to be our infraspinous fossa, and it's really big. Coincidentally, we're going to have a couple muscles called the supraspinatus and infraspinatus. So you can guess where we might find those. At the end of the spine, if we follow it all the way, we have this really weird looking projection. I think it kind of looks like a mushroom from the side, but you think of whatever is going to help you remember this structure. This is our acromion. So this is where our clavicle is going to be attaching at the acromial end. So glenoid fossa, acromion. And who's this guy here? This is the most anterior projection of the scapula, and this is our coracoid process. That is C-O-R-A-C-O-I-D. So this is another one of those cora words. We talked about coracoid. We also have coronoid in a different area. And we also have conoid to make matters worse. So this is our coracoid process with a C. This is one letter where if you mix it up on the exam, you're not going to get partial credit for spelling. All right, so we have our fossa. We also have a couple angles, and these are best viewed again from that posterior view. So we have a superior border up top and a superior angle. So anytime you have like a sharp turn, we often call that an angle. So in this case, this is going to be the superior angle. We also have an inferior angle. So it's not defined in detail here. This entire edge is kind of referred to as the inferior angle, and it's going to be sharper on some scapula and less sharp on others. So we have superior angle, inferior angle. We also have a lateral angle. So again, this is not like a specific point on our scapula. It's actually more this angle formed by the acromion and the tip of that glenoid fossa. So am I going to test you on that? The answer is no. It's too vague to test you on. I can't put an arrow on that and expect you to know what I'm talking about. But these are good things to know to help orient us to which perspective we're looking at. We also talk about the medial versus the lateral border. So this is a little more important because you need to know your medial side versus your lateral side. And the best way to do so is remember these structures here that are going to be lateral. Glenoid fossa has to be lateral because it's going to articulate with our humerus. So if you see this guy, this tells you we're looking at the lateral side here and the medial side or medial border over there. And that's important because of how the joint is oriented. You need to know where the humerus is. You need to know where muscles attaching here are going and attaching to the humerus. Okay. Anteriorly, it's a little more simple. So we do have a subscapular fossa, and that's going to be this entire thing. This does correspond with another muscle name, so we do have a subscapularis that we'll talk about, but this entire face of the scapula is going to be that subscapular fossa. We can also see the superior border and the superior angle really well from this view. If we tilt it slightly, you can see we have a really nice view of that coracoid process. And lastly, we have a scapular notch. So that is this little notch here. Now this is important because there are some blood vessels and nerves that pass through here. You don't need to know them unless you take cadaver lab, but just be aware that there's this scapular notch here that's going to be a passageway for some vessels. So the last bone in that pectoral girdle is going to be the clavicle. We've talked about it a little bit so far, but I want to talk a little more. So if we observe this, we have a flatter end and we have a more round end. And these are pretty easy to confuse with each other, but the main thing you want to look for is a little bump. It's right here. This bump is our conoid tubercle, C-O-N-O-I-D, not to be confused with coracoid. This is conoid. The conoid tubercle is found towards the acromial end of our clavicle, and that is the main way to tell them apart. The sternal end is a little more prominent. It almost looks like a head, but the main thing I would look for is that conoid tubercle on the right, indicating that this is going to be the acromial end of the clavicle.